Hi, we're here today with Coco and Monique. We're going to show you some exercises that Coco will be doing for his physical rehab on his leg. So here we go.
So this is called passive range of motion. Okay, we have 4 joints that we work with. We have their toes, we have what's the equivalent of their ankle, their knee, and their hip. And we want to isolate each one and do one at a time. So when I do his toes, I'm just going to hold onto his leg and flex his toes. Hold it for about 3 to 5 seconds. And then make it as if he were standing. Stretch them out again for 3 to 5 seconds. And that is 1 repetition. Now, depending on how many times a day you do this, 2 to 3 times a day, you want to do somewhere between 10 and 15 repetitions. If you do it 3 times a day, you can go closer to 10. If you do it 3 times a day, or 3 times a day, 10, 2 times a day, 15. So once again, I know we can't see his furs right here. So we just kind of bend the toes, hold it, and then flex them. The next thing we're going to do right here is his little ankle, or it's also known as his hock. Now this one can be overstretched, so wherever it stops, you don't want to push it any further. So again, I'm basically just going to kind of flex it till it stops, hold it for 3 to 5 seconds, and then extend it out once again when it stops. 3 to 5 seconds. So one more time, we flex and extend. Okay, the next is his knee or his stifle. And this one, we're going to basically take his hock. Hold still, Bubba. You're doing so good. Yes, you are. I'm going to take his little hock and bring it up towards his rear end. Hold it for 3 to 5 seconds. And then extend it straight out. And notice I'm kind of stabilizing the knee. I'm not pushing on it. I'm just holding it in place so we don't get any other movement anywhere else other than that knee. So the knee bends and then extends. Okay, the last one is the hip. This is where he's probably going to be the most tender, since this is where his surgery was. Basically, I take my hand and put it along his thigh bone. I don't want to grab the knee, and I'm not going to put a whole lot of pressure. I'm just going to use it to stabilize and just extend it out backwards to wherever it stops. If he starts to seem uncomfortable, that's where you want to stop. You don't want to overstretch it. Hold it for 3 to 5 seconds and then reach it forward. But you're not going to get too much with the forward action. And then same thing, just take it and extend it back. And then let it come forward. You can also do little bicycle exercises where you kind of work all 4 of them at the same time and extend them out to a straight leg. This kind of replicates running, how the different actions that their legs go through when they're running. Okay, and that's basically it, and it works best if you hot pack for about 10 minutes prior to. Helps loosen up the joints, and then after you finish your exercises, do a cold pack to help keep any inflammation down.
Can you explain exactly how to prepare the hot pack and the cold pack?
If you're going to use just like a warm towel, we use like the fluid bags that we have, and we heat them up in the microwave and then wrap a towel around it. You just want something warm, not too hot to the touch. So if you put it on your skin and you can't, if it's too hot for your skin, it's too hot for theirs. So just something warm, and then I just kind of hold on to it. A towel works really good because it's very flexible. You can wrap it around the knee, you can just kind of wrap it around the whole thing, and then just kind of let it sit for a little bit. And then cold pack would just be the best thing I have found. You take like a Ziploc bag and put a bunch of crushed ice in it, and you can even add just some regular like rubbing alcohol, because that keeps it from freezing into a really hard solid piece of ice, but keeps it cold. So it's again nice and flexible so that it can kind of mold around his leg and ice his leg. You're doing very good.
And just in the last 2 weeks of the stretching that Linda has been doing with him, you see a big difference.
Big difference. When I first put my hands on him the very first time and tried to do especially his knee, I just felt a bunch of cracking and creaking in there, and he couldn't move it at all. It was basically stuck in one permanent position, and now I can actively move it, and it feels really good.
And so, Linda, he is using it at times when he walks?
When he walks, he'll use it, but not running.
Okay, and when he walks, he's using it like most of the time, or about half the time? Just so they kind of have an idea of where he's at now.
Probably more like half the time.
Yeah.
Okay.
And the reason that is when they run, everything goes faster, so there's not a lot of ground time. So whenever we are rehabilitating pets with injuries like this, slower is better. Okay, so if there's a way, maybe if we can take like a little towel, sling it around him to kind of keep him. These guys are little, they have high energy, they want to go, go, go. So we call that gait training. If we walk them, make sure that they're walking very slow, because the slower they go, the more ground time they have to actually go through that range of motion of walking, versus when they're running, it's kind of like a horse. If you take a snapshot of a horse running, there is some point where all 4 legs are off the ground because they're just moving so fast. So slower is better to make sure that he goes through that full range of motion.
Okay, and at this point, we're not worried that he's in any pain. We're just trying to loosen up the muscles. And as they loosen up, he'll begin using them
And the
more
joints.
and more.
Yeah,
Muscles
what
and-
happens is there's synovial fluid in each of these joints, and when they're not being used, they kind of crystallize. So that's all that cracking and creaking. But the more we kind of get them working, the more we oil those joints and get it working. Sometimes it can be a little uncomfortable, arthritic almost, but you know, that's why we hot pack, cold pack, and keep an eye. We don't ever extend anything beyond their comfort level, and then it gets better.
And so at this point, we're hoping that within a month to 2 months, he could be using it all the time when walking.
That's possible. It depends on how diligent we are with our exercises and making sure that he goes really slow. Another little exercise that you can do with him, if he'll do it, is what we call sit to stands. So sometimes when they have these kind of injuries, they like to sit on their hip. We want them to sit and tuck their legs underneath. So if we can get them into a good sitting position. I don't know if he'll go into a sitting position. But we want to help them sit normally and not on that hip, and then let them stand up. It's kind of like doggy push-ups. If we can get those legs tucked underneath into a sitting position and then lure them to get up, then they're working all those muscles and remembering how to actually sit right, versus when they sit on their hip and then they use their front legs and they pull themselves up. Then you can kind of, sometimes they start to get real sore in this area because this area is bearing all the load.
And if he never gets to the point of using it when running, that's okay? Mm-hmm. Okay.
I mean, it's not uncommon. Sometimes they can go back to, you don't even know that they had a surgery. Sometimes you can see a little hitch in their get up, but you know, the fact that he's moving it more and actually walking on it instead of permanently holding it up is a great improvement.
Okay. Any final words of advice?
If possible, an underwater treadmill would be fantastic. If you have any sort of physical rehab centers, underwater treadmill is great. Pools can be okay. That's more for the front end, because when dogs swim, they more so use their front end. But an underwater treadmill would be fantastic. Take some of that weight off and, again, make him walk very slow through the water so that he relearns that range of motion.
Okay. Well, you're looking pretty cute today, Coco, and you did very well with your exercises.
You did great.
You did.
All right. Thank you so much.
Mm-hmm.